Hi, my name is Leslie Lee and I am the owner of Aesthetic Creator. And today we're going to talk about microneedling. Specifically to our practice, we use SkinPen. So SkinPen is one of my favorite treatments for pore sizes, kind of acne scarring, that overall just tissue regeneration. It stimulates collagen and it's been around forever. So microneedling, basically it looks like a pen and there's like 12 little needles on the end of the pen, and basically they kind of stimulate the tissue. And so we can actually adjust how deep we're going to go into the skin. And so one of the things I love about microneedling is it's the only thing that I feel can get really close up under the eyes. So a lot of times, we have lasers, lasers is probably like, the next, it's like the level up basically. But the hand pieces for so many lasers are so large that you can't get right up under the eyes. So a lot of times patients will come in and, under eyes and necks are probably two of the most common areas for people to have issues with. And I'm like, okay, well, like you can go do a laser, but unless you are doing which we don't do at our clinic, is they'll put like contacts in your eyes so they can go up around your eyes with a laser. Otherwise, the safety of it, the hand piece, number one, is really hard to get up under the eyes. And number two, we don't want to be flashing, lights or lasers in somebody's eyes and accidentally get it. So microneedling is a pretty safe bet, and I think that it gives beautiful results. Now, depending on who your provider is, right, you can do a microneedling or a SkinPen every 4 to 6 weeks. From a personal standpoint, I think it takes 8 weeks to see the results from one. And I would say that consistently, whether it's, my husband being treated or myself being treated. I kind of like woke up at 8 weeks and was like, oh, my skin looks really good. And I almost kind of forgot that I did a SkinPen actually. This was like when I first started doing them and I was like, oh my gosh, it was that. So super nice treatment, your downtime. So basically you'll come in and we obviously take pictures and then we do a numbing cream. So basically we put the numbing cream on your face and your neck, and anything you're gonna do to your face, we're gonna do to your neck. Like it's just a thing. So whether you're seeing us at our clinic or you're going to a different clinic, if somebody's selling you a laser, an IPL, microneedling, anything, you need to be discussing your neck, because at 50 or 60, you're gonna be irritated with your provider if they didn't tell you to do your neck. So I mean, even my younger patients, I'm like, just do your neck. Like I don't even have necessarily like a price change because the neck is so important to me. Specifically because I've been doing this for 13 years now and so many patients are concerned about their neck. So I'm just like, you're doing your neck. It is what it is. So anyways, when you come in, we'll put the topical on. You'll sit for about 30 minutes with the topical on your face, and then we clean that all off and then do the treatment. The treatment maybe takes like 15 minutes, maybe. And it's pretty comfortable. So a lot of times people are like, oh, is it gonna hurt? And I'm like, it doesn't. Some people will sleep through it, right? Because I should say this, it depends on the topical that somebody's using. So the topical that we get is all prescription. We have it blended for us. So it's not the topical that comes with the kit, is what I will say about that. Some people will use the topical that comes with the kit. I personally don't feel like it numbs as well. So sometimes people will be a little bit more uncomfortable. So if you're sitting there saying like, I've done microneedling and it hurt, it was probably maybe not the best numbing cream, or it wasn't left on long enough. So that can matter. So I don't want to just say that it's pain-free because it might not have been for you. So with that, you sit, then we do the treatment, and it should be fairly comfortable. And I always do the forehead first because that's the area that's the most bony and it loses the topical the quickest. So we want to kind of get that out of the way. So we do the treatment and then you're red, right? Like sometimes people will be super red. I know for a while there it was like the bloodier the face the better, which is not necessarily true, right? Like, so in the world of aesthetics, specifically with microneedling or lasers or different things, you're thinking that we're doing controlled trauma. So basically, if we're controlling how much trauma we're doing, we're also controlling, in some ways, how much collagen stimulation that you're gonna get on the back end, right? Now, this is very patient-specific and age-specific. So the younger you are, probably the quicker you're gonna heal and the more collagen you're gonna, produce from a treatment versus like as you get older, your collagen stimulation is already lower. So we will not get that, significant or the change that we got from somebody who's a little bit younger. So I think just being super transparent about that, like you're probably gonna need more microneedling treatments than you would if you're 25 versus 65, right? So we're just trying to do, and again, it matters how much you've been taking care of your skin as you've aged as well. So you come in, you're red that day, you get more red as the night goes on. So you might leave there looking a little pink, you know, sometimes depending on how deep we go, you could get, you know, a nice redness, and it can take a little bit while. Like those bony structures, sometimes the nose gets a little bit more red. We really don't want to get like those photos that you've seen online of like everyone's face being bloody. That's, I think, too much trauma, because we really want to be kind of in that standpoint where we're just saying, hey, we want you to heal, hey, we want you to heal, versus like we're gonna just kind of obliterate your face and you're gonna look terrible. That's not necessarily the goal with microneedling, in my experience, and from what I've seen from results as well. So I think that our tissues are only made to experience a certain amount of trauma before it's kind of lost. So with microneedling, you're red that day, and then you kind of get more red that night. So if I'm saying, you know, I probably wouldn't plan for a dinner that night. And just a personal story, like I got my husband to do a microneedling one time, and we were supposed to go to dinner afterwards. He looked in the mirror after, and he's like, I'm not going to dinner with you. And I was like, okay, well, whatever, you know, kind of thing. So anyway, so you do get more red as the day goes on, so fair, you know, kind of thing. I, on the other hand, would have gone anywhere because it's no big deal to me. So really just being kind of mindful of like, you know, what you're comfortable with. Like, are you gonna wanna go get groceries after? Maybe, maybe not. So you're red that night, and then you wake up the next day and you're just kind of pink. Sometimes people get a little bit of swelling, but for the most part, you might just be a little bit pink. And actually after 24 hours, you can put makeup on and do all the things. And we send you home with little, like post-treatment serum. So there's a hyaluronic acid serum that you're using, and then there's also like a recovery balm that you can use. I think that washing my face that night is kind of burny, so I typically will not wash my face that night. I'm like, I've already cleansed it, we did the treatment, put these serums on, and kind of wake up the next day and then wash your face. I feel like it's a little bit more comfortable for me, but you know, it's not gonna hurt you if you decide to wash your face. Then after that, I would say you sometimes will get a little bit of like flaking, almost like sunburn flaking, and it's typically like around the mouth, where it just looks a little dry. So that I would say is pretty minimal as far as downtime. So microneedling is one of my favorite treatments for around the eyes and for the neck, just to start to stimulate that collagen, especially for patients that don't have a lot of downtime. Because, you know, some of our bigger lasers, you need a week or two of downtime, and a lot of people don't have that, you know, into their schedule. So realistically, microneedling, you're gonna do one per 10 years of age, and if you're seeing me, I'm like, well, I would wait at least 8 weeks in between the treatments, just because I think your pore sizes look so much better at 8 weeks than they do at 4 weeks. And so a lot of times for patients, I want them to start to see the result from something that they're doing before I'm asking them to do another one. So again, microneedling is one of those things that's gonna help with pore sizes, crepiness, kind of fine lines, wrinkles, those under eyes, like that is, I think it's beautiful there. It stimulates the collagen. Under eyes are really hard to treat in general, and it's really hard to get something up close to the eye. So that's the best thing. And then maybe a little bit of swelling and a little bit of redness. So for me, microneedling is one of my favorite treatments. I think really at any age you can be doing it. It's just kind of helping with that collagen, you know, stimulation. You're just looking better. So again, at Aesthetic Creator, we really want you to be intentional about how we're doing things and why you're doing them, and really just being mindful of the way that you're aging and taking care of your skin. So we look forward to seeing you in for some microneedling.
That was